I think a lot of you watching this video are usually freaked out with two things when we talk about lip enhancement. One is a natural looking lips like duck lips, and the second thing you're worried about is pain during a lip enhancement. So the good thing I can tell you is that when I do lip enhancement, it's pretty much painless and it's all natural. So those are the two concerns people have. In this talk, I'm going to be talking mainly about how to do injectable fillers in lips. I'm not really going to talk about lip lifts, lip reductions, or other procedures that require surgical treatments. I'm going to talk just about lip enhancement using fillers. So fillers that I prefer are Juvederm and Restylane. They're both hyaluronic acid products. They're great because they're reversible. They're very soft in the lips and very natural in appearance. And the way that I do lip enhancement, first of all, is painlessness. So I don't believe in injecting lips without a dental block, with some exceptions. If we're talking about a gentle technique of enhancing, I can actually do that without pain, without a block. But if I'm really giving a luscious full lip that still looks natural, I'm going to do a dental block. My dental block is painless. You said there's no way, Dr. Lamb, your dental block is painless. I've had one, it's so painful. The doctor doesn't know how to do a good dental block. The second problem is they're injecting way into these big nerves. You don't need to do that. You just go right in these areas. The other reason people say I don't want a dental block is it lasts too long. My dental blocks last between 15 minutes to an hour. The other reason people don't want dental blocks is the fact that they feel like their heart is racing. Mine does not have epinephrine, your heart won't race. So it's painless and fast. You said, well, then how do you do this whole thing if you're not doing a dental block? You said it was painless, Dr. Lamb. Well, there's a slight discomfort without the dental block, but the way I do it, if I'm just enhancing small little areas, especially if someone, let's say they're 45 years old, they're already doing fillers elsewhere, they want to drop a filler in their lips or doing some other things, then what I'll do is I'll take a cannula and just slide the cannula from outside this way, and they really don't feel it. And a cannula basically is a needle with a blunt end. Causes a lot less bruising and very little discomfort. The thing you don't want to do is stick a needle right through the lip. So that's the concept of painlessness. I also give you a little bit of an oral steroid that reduces that, and hopefully you don't have much swelling or bruising, especially if I'm using a cannula, which I usually do, to minimize bruising afterwards. Let's talk a little bit about the aesthetic goals of a lip. What are the things I don't do? So first of all, I don't do borders. I think borders look god-awful, okay? I don't care what you say, they don't look right to me. There's something wrong with that look. And if people always worry about, they say, look, hey, I can tell a lip when it looks fake. I can tell you, you probably can only tell a small percentage of the fake lips. I see many more lips that look fake to me than you probably can even see at a cocktail party. If you're at a cocktail party, you probably see 3 out of 10 women that look fake. I'll see all 10 of them that look fake. So borders look crazy, all right? I don't know why people do that. It just looks absolutely stupid. And also when they're trying to rebuild filtral columns all the way out here and go crazy with a white lip, it doesn't look right either. The other thing I've noticed is on the outer lateral lip, on the top lip right here, the lip has got to go to 0, means that it's got to taper to 0. What I've noticed on the top lip is when the lip is open and you got fillers, they try to fill out to the edge, you can see where it sort of hangs down. It's something I correct surgically all the time with lip reduction, so it's something that I try to avoid when I'm doing fillers because I don't like that look. And people, will it look good then? Yes, because the pout is in the center, not on the sides. Now on the bottom lip, yes, I go farther out. But on the top lip, I try to avoid the farthest corners because it just doesn't look right. So the technique, the style that I design is there's 2 circles here. You may be able to see it in my lip. 2 circles here and 1 larger circle in the middle. So 1 here and 2 here. That's the basic concept of design. If you can create better pout here and a little bit here with a slight division there, it looks really pretty. If you try to make the division way too wide, it doesn't look natural, right? If you make it uniform and all the way across, it looks like a duck. If you put too much border, it looks like a duck, so you don't want to do that, and that's really important. The other principle that I talk about is the lips must follow the face. What that means is I have these 50-year-old women that come in and go, I want my lips to look really good, and they have these photos of 20-year-old women from Vogue, and they look at and they, oh my God, I can't make that lip on you, it won't look right. Plus, I didn't talk about lip lifts in this video, but when the upper lip starts to hang down, you make it super full on a 50-year-old, you're gonna actually cover the teeth more. It's gonna make you look older or dramatically show that white lip being too long. But the concept of the lips following the face is simply put as, if your face has not undergone rejuvenation, you want a 20-year-old lip, it looks crazy. So what I always do is I first rejuvenate the face, if the face needs rejuvenation, and then I offer you the lips. And then when I do the lips, I make the lips match the face, not the other way around. You cannot have these ridiculously young looking lips on a face that's older and then you try to blow up the face to make the face look like the lip. It's not a smart way of doing things. It's also a waste of money, because I always tell my patients that when we connect with each other, we connect with the eyes. Now, what is too old for an incredibly full lip? Now, you're going to be shocked to hear this, but even a 30-year-old should not have a massively large lip. If you look at nature, only like college students, 25-year-olds have really full lips, but as you start getting into the 30s, your lips start to become a little thinner. So, well, how much lip can you do? It depends on how young your face looks. If you have pretty well-preserved features, you have a fuller face in your 30s and you haven't even undergone fillers, I can do a little bit more in the lips. You say, well, how much more, Dr. Lamb? That's where artistry comes in. And this is where, when I design lips, I always use my right brain and my left brain. My right brain is the artistic side that says, look, that's not going to look good on this person, right? You can tell, you match clothing, you say, well, that clothing doesn't match for me. How do you know it? Is it a scientific algorithm? No, it's the fact that your eye says that's ugly. So I have a really good eye, and that's what you really pay me for, is a beautiful artistic design. Now, the other question people ask is, how long these fillers last? I have noticed, which is shocking, that they can last many years. Now, it seems like a lie. You Google it, and you're going to say, oh, fillers only last 6 to 12 months. There's no way that can happen. And that's absolutely false. I have patients that come in, I can see they have fake looking lips and they had it done 7 years ago. And they go, it's gone away, Dr. Lamb. I said, look, I promise you it's not gone. I see it there. So I can see that's there. So I always tell my patients is that my ultimate goal is that you look natural, okay? And I will tell you, I have some patients that don't care to look unnatural. I have a lady that I've done her other fillers for her, but she goes somewhere else for her lips. To me, having those lips done somewhere else destroys all my other work. So I will give beautiful, tasteful work. I may even tell you to dissolve your lips if they look crazy, because I just can't stand fake. If you sort of like a semi-fake look, don't call my office. I just ask you that favor, okay? I enjoy my work. I love what I do. And it's not just a marketing pitch for you to say, look, hey, oh, he's going to sell me natural. No, I stand behind it. I don't like fake. If you really, really love fake looking lips, and I've had it. I had a lady from Los Angeles that said, look, I like fake. I said, don't come. Don't even pick up the phone and call me. Don't come. Because I don't want to do it. I don't want to see you. I'm sorry. It's just my choice. You choose me as a physician. I choose you as a patient. It's a mutual relationship. And we're dating until I do something, right? And then we're sort of married, but you can always divorce me and leave me. But my point of this is that if you like natural, please see me. But if you don't like natural, don't bother to see me. And if you have friends that need correction, if they think they look good, don't send them here. They'll get in a nice little angry fight with me, because I can't stand fake. It just makes me nauseous. So that hopefully will give you a good understanding of some of the principles of lip enhancement.